Hello from Jonathan and from me. Welcome to Thursday's Anglia Tonight.
First this evening, shocking claims about the way elderly patients have been treated in some of our hospitals.
They're made by the Patients Association in a report based on complaints they received from families across Britain.
Well, several live in this region and now they've decided to speak out. Emma Baker has their story.
So, she was a very family-orientated person. She loved her grandchildren and they all miss her enormously.
Anne Robson is remembered by her family as a gentlewoman who rarely complained. But they say her final days in West Suffolk Hospital left her a shadow of her former self. She died 6 hours after she was discharged.
Every time you spoke to her, she sounded like she was very dry in her mouth, and she said how thirsty she was. And she just kept saying, no one gives me drinks, no one helps me eating, no one... I just need help. We feel very strongly that the lack of care led to her death.
Sadly, Anne's story is not a one-off. A new report by the Patients Association criticises the way a number of elderly patients were cared for across our region, including Muriel Browning, who died in Ipswich Hospital last year. Her daughter says she was denied the dignity she deserved.
She said, "I want to die, I want to die." And I said to Mum, if I was in that state, I too would want to die.
While there's no suggestion of errors in the hospital's medical care, both hospitals have apologised for any distress caused.
We aim to learn here and we aim to improve. This particular ward is quite outstanding and receives the highest of praise constantly. On this occasion, clearly, we did not meet the family's expectation, and we've been very clear in our apology to them about that.
Whatever the agreements or disagreements about what actually happened with her mother, I think we'd all agree that the care could have been better. And I think all you can do in those circumstances is to apologise for that and try and make it better for every other patient who comes in.
Muriel Browning and Anne Robson aren't the only patients who've suffered. The Patients Association highlights 3 other cases in our region and 17 across the country. The government says it's determined to address the problems highlighted in today's report.
There needs to be strengthened responsibilities around whistleblowing, and we want to give effect to a duty of candour for NHS organisations so that we do throw open the door so that people can see for themselves and challenge poor practice and actually start to see a change.
The Patients Association is now calling for matron-type figures to be introduced on wards to raise standards of care. Liz Pryor knows that any improvement is too late for her mother, but she's desperate to ensure no one else has to suffer in the same way. Emma Baker, Anglia News.
Well, earlier I spoke to Kieran Mullen from the Patients Association charity. I began by asking him to describe the specific areas of concern for patients.
From what we hear about on our helpline and from other research from other charities, it seems like the basics of care, the essential nursing care, these are the things that are being missed, and these are the things that are causing real distress to patients and their relatives.
So how does the nursing improve? What do we need to do?
I think we need to be looking to introduce perhaps an independent matron at every trust, somebody who would go around and focus on these essentials and not be squashed by management if they're perhaps not focusing on them. And we need to review the complaints process so it's much more robust.
And how can patients and families actually help themselves, do you feel?
It's very difficult, and the real challenge is obviously that if they could help themselves, really, we wouldn't need to be here making these claims, so there isn't really anything that will fix it for them. We say try and raise concerns at the time with staff, though we know that doesn't always work. Perhaps have a formal meeting, write down your questions, ask for specific things like fluid balance charts if you think that your relative isn't getting enough fluid, turning charts if you think that your relative might be developing a pressure sore and they're not being moved enough. Complain if you think that might get results. Again, we know sometimes it doesn't, and we also appreciate that it's very hard, particularly if the person is still in hospital, to make a complaint, because you know when visiting hours are over, you have to leave, your relative stays, and they're being looked after by people that maybe are going to get in trouble because you've complained. So I don't think there is any easy tip we can give people. But please, of course, do get in touch with our helpline and we'll try and advise you as best we can.
And if you could say one thing to the Health Secretary, Andrew Lansley, this evening, what would that be?
I'd say this is a new government, lots of priorities, lots of planned changes for the health service, but please, please, please keep your focus on sorting these kinds of problems out as soon as we possibly can.
Kieran Mullen, thank you very much indeed for joining us this evening.
Thanks.
Now, the snow is falling again in Essex and Suffolk this evening, and there's more expected in Norfolk later.
It now looks as though the cold snap will last well into next week. So how are you coping then?
Staying warm and getting about have been the major problems. Tom Barton has been looking at how we've managed to keep on the move.
The Taylor family from Basildon had the right idea this morning. They'd certainly dressed for the weather. But was the rest of the region that well prepared? The biggest problems have been on the railways, with reduced services on many lines. Trains from Witham to Braintree and Stratford to Stansted Airport are tonight being served by replacement buses.
Not much information. All the signs are down inside, so yeah, not very good.
I've come from the other side of Woodbridge. It's taken me 2 hours to get to the station. We're heading to Exeter, so we've got a long day.
Essex saw the heaviest snowfalls, although this morning main trunk roads like the A12 near Chelmsford were running smoothly. The A130 was heavily congested, but problems with gritting operations over the last couple of days seem to have been smoothed over.
At the end of the day, we always say only travel if absolutely necessary, and to take blankets and a hot drink and a shovel and a mobile phone that's fully charged so you can call for assistance. And they have been doing that. The vast majority of people have been very, very conscious of the difficulties that we're experiencing on the roads.
The roads here in Basildon certainly seem quieter than usual. It looks like many people are taking the advice of the authorities and not going out in their cars. And frankly, it's easy to see why, because the snow here is several inches deep. Just look at that. Those who decided not to drive have taken to other ways of getting around, like Chelmsford nursery worker Katie Meekings. For the last 3 days, she's got up at 5 a.m. to walk into work.
The first day it was pretty bad. Yesterday it wasn't as bad. It was a lot clearer, but today has been the worst one, I think, because there's a thick layer of ice underneath that snow, and it's a lot harder to walk in than it was on the first and second days.
For those travelling further afield, our airports have escaped the worst of the snow. Any disruption at Stansted and Luton caused mostly by problems at other airports.
We've had 1 or 2 cancellations to destinations such as Edinburgh, Newcastle and Dublin, but these are airports themselves who are actually closed to business. All of our European operations are working very satisfactorily.
In Basildon, the graffiti teams weren't cleaning paint off the walls, but snow off the footpaths. And with more snow expected in eastern and coastal regions overnight, there's likely to be disruption again tomorrow. Tom Barton, Anglia News, Basildon.
Well, Tom has finished his travels, but he's still out in the cold. Poor thing. Tom, what's the latest on the travel situation this evening?
Well, Becky, this morning I was in Basildon. Today I've driven pretty much the whole length of the eastern half of the Anglia region to here in Norwich. There's been snow on the ground almost the whole way, and it's been absolutely beautiful. But, as you saw in my report, there has been that disruption. Some details: there's those line closures on the railways between Witham and Braintree and Stratford and Stansted Airport. There's disruption on much of the rest of the National Express East Anglia network tonight as well, and problems on the Thameslink route between Bedford and London. Bad news as well for football fans. Saturday's match between Southend and Macclesfield Town at Roots Hall has been cancelled. Hundreds of school closures once again today. Almost 600 schools, colleges and nurseries in Essex have been closed, and there's been around 25 schools closed in Suffolk. As you said in the link a few moments ago, it's been snowing all day in Essex. That snow expected here in Norfolk tonight. This disruption, I'm afraid, is only going to continue.
Oh dear, thanks for that update, Tom.
How gloomy.
And we'll have more on